I'm going to walk us through a bit more of context for this next portion of our program. So Frank kind of began setting some context and introducing some main findings that came out of the Alliance's report. But we just wanted to highlight once more a bit of the framework that we've been working in. And through all our discussions and through all our surveying and research, there were really three main barriers that we saw that exist and really intensify disparities and make this digital divide lead to greater inequity. And the first is lack of connectivity. The second being lack of equipment. And the third, just as Representative Natalie Bay just mentioned, lack of digital literacy. And these three barriers are really what we dove into in our conversations and in our dialogues with our community. And then if you see the little note in the bottom, cutting across all these barriers is really an issue of not having adequate policies to really help us at the organizational, legislative, and systems design. So there's work that's been started, but there's so much more that can be done in this arena of policy as well. So we're hopeful that you all, when we do our Act Now groups, that you're able to bring some of that perspective into our conversation. So those were our three barriers. And I think as we've been talking about today, everyone is really impacted by this digital divide in some shape, way, or form, but there are a few populations that really were highlighted to us. One being people who are children and youth, people without homes, people who identify as Black, Indigenous, or other people of color, those with physical disabilities, recent immigrants, English language learners, people in rural areas, and I'll also add people in urban areas, people with mental, intellectual, and developmental disabilities, older adults, and always spoken about as well and mentioned people who are low income, especially when we're talking about affordability and access. So these are a few of our populations, and we're presenting this to you, but we know that what's more impactful is often storytelling. So we're excited to have a panel this morning to share a little bit more of their personal and professional experiences in working with people who experience this digital divide and other digital inequities. So if we can go to the next slide and highlight who our panelists are for this morning. Here we have Mary McClintock from Community Action Pioneer Valley, Paul Foster from Springfield Public Schools, Beatrice Dewberry from Wayfinders, and Dave Christopoulos from the Hilltown CDC. So I'm going to be introing our panelists one by one, and we have Mary here to kick us off this morning. So for those who do not know, Mary is the Community Collaboration Coordinator for Community Action Pioneer Valley, and her work focuses on Franklin County, and she has lived in Conway for 37 years. So she definitely knows what she's talking about when it comes to kind of this rural perspective. So Mary, we invite you to share some remarks with the group this morning.
Great, thanks so much, Brittany. Yes, it's interesting to read sort of abstract, but here's some stories behind that abstract. So rural issues. So while I was facilitating a really intense conversation on a 30-person Zoom work meeting I was hosting from home during the pandemic, my DSL-based internet cut out and ended the whole meeting. I learned in that moment an essential living in the hills with DSL lesson of always making one or two co-hosts on any Zoom meeting I run from my home. If I get kicked off the internet, at least the meeting will continue. Just this last week, I participated in a Zoom interview with a job applicant who lives in the Hampshire County Hilltowns. She attended a Zoom interview sitting in her car in the local school parking lot. And had a hard time maintaining connection. I know Franklin County families with multiple children who couldn't all attend remote schools simultaneously because they don't have enough broadband capacity. And I can't count the number of meetings I've attended in the North Quabbin region where we bemoaned the lack of child psychologists and child psychiatrists. This was pre-pandemic. Now, because of increased access and payment for telehealth services, North Quabbin kids can meet with their providers by sitting at a computer in a private room at their school. And then folks who live with low income. Here's some quotes from what we heard in our surveys, that you can see in our report. Conducting trials or mediation on a cell phone puts litigants at a disadvantage over other parties with laptop or desktop units. From Springfield, we heard, when you can't even pay 30% of your income for rent, how can you pay for the internet? From Greenfield, we heard, many of our clients do not have enough money to feed themselves, let alone purchase internet access or equipment. Vulnerable families can feel overwhelmed by the multitude of online offerings and supports, while also suffering from a lack of internet connectivity and insufficient devices. From Charlemont, we heard low-income students often have worse Wi-Fi and participate less in class. It impacts their meaningful access to resources on a daily basis and leaves their children further and further behind in terms of digital literacy. And then there are the folks that don't have stable housing. I know a number of folks. This month, I met an older man who walked into Community Action's office asking for help to find housing so he could stop sleeping in the cemetery. When the receptionist said, well, please call this number, he said, I don't have a phone. He doesn't have a way for service providers to reach him by phone, let alone fill out the many online forms needed to access services. And I can't count the number of times I've heard people I know who don't have stable housing say that they missed an important message or were delayed in getting the help they need because they didn't have a way to check email. So long before there was a digital universe, redlining and other systems of white control created a divide between those with wealth and access and those without. The digital divide is another form of redlining that contributes to the generational wealth disparity impact that redlining had on BIPOC folks. Please join us in working to bridge the digital divide and create true digital equity to make sure that everyone in all communities has full access and ability to use the internet.
Thank you so much, Mary, for sharing those stories. And we invite folks to respond in the chat with any reactions or comments in response to our panelists' remarks this morning. So next up, we have Paul Foster, who is the Chief Information and Accountability Officer for the Springfield Public Schools and manages technology, data, digital learning, and planning in service of the district's educators and students. And I think, Paul, we saw you many times with the hands up, frustrated during this past year. It's been phenomenal to have you on our team. So we welcome you to share more with our audience today.
Great, thank you, Brittany, and good morning, everyone. It's nice to be here with you all, and it's nice to see so many people engaged with this topic. So I'm just to give context in terms of the population we serve in the Springfield Public Schools. Our students, I think most people probably know this, our students are predominantly students of color, are coming up from households with economic disadvantage. And as the report indicates, lack of internet connectivity and fast enough internet connectivity were the number one issues for those with low income and for children and youth. And also in Springfield and for BIPOC communities, a lack of equipment was the biggest gap, but lack of connectivity was sort of a close second. And the COVID pandemic really shined a spotlight on the divide facing our students and families. But I think it's so important in this context to talk about the fact that the divide existed pre-COVID. It will exist post-pandemic. And one of the things we worry about is, as the short-term pandemic-related solutions disappear, what does that mean going forward? And so what I want to do is I want to paint a composite picture of the digital divide for our families in Springfield. So this is sort of a picture of a hypothetical family, but based on many of the things we've heard over the last 18 months. So take a family of four, a family with 4 children living in Springfield, the children attending the Springfield Public Schools, whose parents work in the service sector, not earning a living wage. They don't use a computer in their workplace, and they don't have the privilege of working from home. So Springfield, we were able to provide all 4 students with a quality laptop computer, specifically not the cheapest thing we could find. And these computers also let other household members access services like telehealth, job applications, or even vaccine appointments, since a device was the easiest way to make that happen. This helped our families with the equipment gap. Next, the district endeavored to provide the family with no-cost at-home internet, but the family had to arrange service through the cable company's call center. That family may have received misinformation from the call center saying they weren't eligible because of previous debt, even though that was not accurate. Once the service was arranged, the cable company sent a setup kit delivered a setup kit to the family, and the family then had to go and figure out how to set up their wireless router and connect those 4 student laptops to that router. For the youngest child in the family, who might need help connecting and signing into Zoom, the parents are struggling because they may not have used a computer before, and by the way, they have to be at work. The parent calls our student help desk, but they're frustrated by unfamiliar language: Wi-Fi, start menu, icon, browser, control button, Ethernet, audio settings. Once connected, the students repeatedly drop from Zoom because the free or low-cost options from the cable company come with the slowest available speed. They also rely on older cable infrastructure where the speed drops further as more and more members of the neighborhood go online and are riding the same cable to get that access. It's not enough speed for all 4 students to learn at the same time. The family calls our help desk again, but faster speeds, which is the only solution, cost between $40 and $100 a month and aren't guaranteed anyway, because if multiple households in the neighborhood are using that same infrastructure, this family's not getting the maximum speed that is kind of offered with whatever they're purchasing. So I would say a lesson learned in Springfield and from this story is that for children and families, for people with limited incomes, for BIPOC residents who are concentrated in our urban centers, solving the digital divide is not as simple as providing a device, a connection, and basic tech skills. I think, when Frank highlighted the definition of digital equity earlier in our conversation, I love that definition uses the word benefit, that people can benefit from digital technologies. And we need to be really clear that bare minimum solutions do not result in benefit and do not allow all people to benefit. And so digital equity requires a real computing device that's usable for multiple and complex purposes, a connection that is fast enough and reliable enough for an entire household's diverse needs. So that includes 4 kids being able to be live on a video conference at the same time, or more than 4 kids, and the skills to flourish, not sort of barely use the technology. So for our Springfield families, I worry about solutions that give the illusion of connection, but create a new divide between those with the privilege to thrive in our online world and those who are just barely online. Thanks, Brittany.
Thank you so much, Paul. All right, up next we have Dave Christopoulos, who's the Executive Director at Hilltown CDC. So Dave is also a commissioner for the Massachusetts Rural Policy Advisory Commission and president of the MACDC's board. Dave lives in the Hilltowns and is a rural advocate. Hilltown CDC provides comprehensive rural development services in the Hilltown region of Massachusetts. And installing broadband and internet technology in the Hilltowns has been one of the most important economic development issues to be addressed in the region. So Dave, we invite you to speak more about this with our audience.
Well, thank you, Brittany. I really appreciate that introduction. And welcome, everybody. It's nice to see everybody here, and I appreciate being a part of this effort. I'm going to speak a little bit about the rural impact of this issue. And, Brittany did the intro a little bit. I do live in the Hilltowns, and I don't have broadband at my home. It has been challenging for me to run this nonprofit through this pandemic. And a lot of my employees also did not have internet at home, and it was difficult for us, but we made it through. And I do have broadband at the office now in Chesterfield. It's making a big difference in our productivity and our ability to, kind of compete and communicate. But I also just wanted to bring us back to what was spoken about earlier. So I think it's the most important part of what I want to say. And, I just want to go back to Frank's really excellent introduction and how honest he was about this problem that we're facing. And I do think that it's very important for us to see this as a civil rights issue, a human rights issue, and that it's important for us to remember, no matter how we're looking at this, that we pay attention to how it intersects with racial equity and all the other work that's going on in our country. The problem that we see in rural communities is set up in a couple ways. I see the broadband as a 21st century infrastructure. We hear a lot about infrastructure these days, and it looks like there's going to be investments made. that argument needs to be right out front. It's also a public utility. We've kind of heard that a little bit. Both of these realities have been a challenge for rural communities across the country, and we're not immune to it here in Western Mass. Natalie explained a little bit about the history of connectivity in the hill towns and the rural communities of Massachusetts, which also we see out on the Cape. And having lived through it, it's been very challenging to navigate our way through this problem. But rather than dwell on the past a little bit, I think we're in a situation now where the conditions are changing, and they've changed pretty positively in the last few years. Most of our towns are being connected now, and most of the residents are receiving some sort of connection at their home. I will be probably getting mine in March. It's going to change my life. The other part of what I wanted to mention to you all is, in addition to this effort that's happening, I've been involved with a group called the Rural Policy Advisory Commission. This group was appointed, I've been involved about 6 years, and this issue is something that we looked at early on as the broadband initiative was moving forward and working out agreements with our towns to connect us. The commission was getting updates and making recommendations. And so, I remember over a decade ago talking about getting these connections in our towns, and it became clear that there needed to be a public investment, and there was a public investment made, as Natalie mentioned, $100 million. And now we're looking at potentially coverage all across Western Massachusetts. But I think now we're at the point where this network, now this group of advocates, can help take us to the next step. Really, it's the building of these networks will be completed, and we need to shift our attention toward affordability, reliability, sustainability, and usage. And I think that's where this group can come in, really be really helpful, particularly in the world that I deal with each day in the hill towns. And I would just add to this, because it hasn't really come up yet, but the other issue that we see related to connection to internet is cell phone coverage. And we lack that across our region here too. I wanted to just share with you a couple recommendations that have come out of our Rural Policy Commission and invite you to continue this conversation in the action part of this at the end. If you're interested in public policy as a way to address this, I'm going to be joining one of my colleagues to have a discussion about that afterward. But here's a couple things to think about if you're interested in participating in that way. Integrating broadband adoption and digital inclusion and literacy into state policies, we feel is an important recommendation to consider. Creating digital education and literacy training programs, providing discount service options for low-income households and low-income businesses, and creating an inventory of public computer centers so people know where they can access them publicly. A couple other quick things I'll mention before I wrap up. I think that there's a huge potential for economic activity and economic development with this technology, and the more that we can share with everybody, the more it's going to benefit all of us. And one of the ways that we're looking at promoting this is through what we call digital literacy program or digital navigation program to train people how to use this technology and how to understand how to navigate your way through the different options you have in terms of purchasing different equipment or services. We believe that the state could create a revolving loan fund for broadband expansion or other types of assistance. Some sort of data-driven assessment to determine the cell coverage issue in Massachusetts, I believe is being worked on to some degree. And continue to look at the systems that have been set up, the broadband 1, 2, 3 network. I think that as we grow the system out, we have to continue to look at affordability. And we're going to need to engage our legislature and our governor's office around this. And so part of my goal today in the after party is to hopefully work with a few of you guys to see if we can form some sort of a plan going forward to assist the Alliance in kind of influencing policy in the state to address some of these issues that have been brought up today. And I think I'll just leave it with that, and hopefully see some folks at the end. Thank you.
Wonderful, thanks, Dave. And then
I have a question from Frank.
Sure.
Would you like me to try to answer that real quick right now?
Sure, why don't you just mention that really quick?
I'll do it quick. Yeah, so thanks for asking, Frank. This is a new service that I had mentioned real briefly, and Frank brought it up, called Digital Navigator. And my organization is participating with about 12 other rural CDCs across the country. And it's a demonstration project where we have been trained in what's called digital navigating. And it's basically a multi-pronged approach where we worked together as a cohort, did some research to identify what resources are available in your local region. You work with this group and we did it together. And so I now have a resource guide that's being developed, and it kind of tells me within an hour or so what's available to people in the marketplace for this type of technology. How can you get discounts, that kind of thing. So we're building up a resource guide. The other part of it is to use some of the funding that we have to assess people's needs. So we have kind of a standardized assessment tool that we're going to start using this year. And one of our main focuses in the Hill Towns is going to be on small businesses, particularly to recover from the pandemic. If we can do a baseline assessment of what their technology needs are, we may be able to help them move forward. There's going to be a fair amount of resources available with recovery money that we anticipate continue to come. And so we're trying to set that up. And it's a peer support type network. We are proposing to try to expand this and bring this to the Alliance, and maybe something that we could look at and try to scale up. I do believe that we're seeing this as a national model. So that's the basic Digital Navigator program. And I can share more information with the Alliance so it's available to the public.
Wonderful, thank you. And there's been a ton of action in the chat, so feel free for our panelists to respond to any of the information coming in through there. So last but not least, we have Beatrice Dewberry, who is the Community Building and Engagement Manager at Wayfinders. Her community building work has centered on Springfield and Holyoke, with a particular focus on working with older adults, lower income families, and engaging with BIPOC residents in the Mason Square neighborhoods in Springfield and Churchill, Old Churchill neighborhoods in Holyoke. So, Bea, we welcome you.
Hi, my internet paused just as I was about to speak.
I don't see your face. You're welcome.
Oh, gee, do you see me? Okay, I'm here. Hello, everyone. Thanks so much, fellow speakers. You guys captured a lot of my thoughts as well, but I'm gonna focus a little bit more on the unique needs of our older adult population and English language learner population. I've been very fortunate to work closely with residents in Springfield and Holyoke. So that means I also get a lot of wonderful feedback and useful information at determining their needs. So we all know that broadband and access has taken a larger role in everyone's life. We need it for school, for work, telehealth doctor visits, accessing resources. I think Paul and Mary both talked about a lot of agencies now only have removed paper copies, so people need to go online. And so what we found with many of our older adult residents at the start of the pandemic, there was a lot of concern about that because many of them had not used technology at all. And despite it having become this sort of main source of communication for others, what we found that the unique challenge many faced at the start of this pandemic in particular, and still now, is heightened social isolation among our older adults, a total disconnect with technology and use of technology devices, literacy skills and understanding of terms. And then many did not have Wi-Fi. They had it on their phones, but not in their homes. And so that also posed another unique challenge. For our English language learners, we were hearing things like, again, similar issues, lack of access and devices, but even the language itself. Think about, Paul spoke about unfamiliar terms and having to help a family sort of, understand terms like Ethernet. And but imagine if you now have to translate that into your native language, which is not English. So a mouse is ratón. Email, we all use it. It's just so common vernacular. But if you're recently here from Puerto Rico, you might know of email as el correo electrónico. And I'm not a Spanish speaker, so forgive my pronunciation, yet it's not translated on websites. It's still insert your email. And so again, there's even more distinct challenges for English language learners and our older adult population. So with Wayfinders, as we were, calling people, we had to go back to, Ma Bell. I saw someone put that in the chat, but we had to go back to picking up the phones and calling people to determine need, because we had no way of engaging with them directly because of the divide in particular, not having access. And as we heard more and more stories about need, our AmeriCorps Vista member, who's now a staff member at Wayfinders, Emily Tebald, is our community engagement associate, on her own decided, I'm gonna create a step-by-step tutorial on how to access Zoom and put it on YouTube. And we texted that out. And again, now talking people through the process of even getting to YouTube to learn how to use that. Our community engagement coordinator, Anna Cruz, actually met someone in a parking lot at a gas station because she was just so frustrated about not having access. And so she downloaded the Zoom app for her on her phone. But we knew these were just quick fix solutions. They were just a way to help us immediately connect with our residents. And again, many older residents, and we all knew they were identified as the most at-risk population at the start of this pandemic. Yet they were left with the least amount of resources when it came to accessing technology, which was this new space that we all went to. Again, this was a quick fix. We decided to pursue funding to see how we could do a little bit more. We were successful in getting a mini grant from Health New England to provide some Chromebooks for a few residents, do some digital literacy training that was subcontracted through Dress for Success, and their trainers were phenomenal. And so where are we now? Even after all of that, even with the training, and again, that was just a small, it's not even a solution. It was just sort of a mini bridge to help a few. What we're finding in the feedback that we're hearing, I'll read what one of our older adults said. They're at least now giving telehealth a try versus writing it off completely. That's a win. One said, my relationship with technology is like arthritis. I have to live with it. I can't fight it. It's not going away. I have to work with it, exercise, and not let it get the best of me. And I was like, oh, gee, that says a lot to me. And still many have gone on to say it's too costly. I wish I still could use my flip phone. I'm forced to spend money that I don't have to use this just to be a part of society. There's still a lot of fear. We had one older adult resident who had been hacked, and she described it as feeling like someone had broken into her home and had invaded her privacy. And now every time she goes on to this device, she has that same level of fear, and that's very concerning. For English language learners, again, we spoke about just the translation. We already know that even in the best of times, Latino students are subject to, English language learners are subject to educational disparities. So can you imagine now, as we're going through this pandemic, as we're navigating this divide, how much that is impacting and impeding their ability to learn and succeed, I'm sorry. So I just want to say in closing that when you combine the digital divide and all of these barriers, they're exacerbated due to these inequities in language usage and the unique issues that older adults face. And I feel like the line between inclusivity and exclusivity is drawn even wider for these two populations in particular. Many speakers before me have talked about ways in which we're hoping you guys will join us in addressing this problem, really working to build equity. And I just want to add that I think we have to be mindful to make sure that for non-native English speakers, that language is part of the policy discussion, and also that the unique needs of our older adult population is considered as we pursue this civil right for all of us. Thanks.
Thank you so much, Bea, and thank you to all our panelists for sharing those stories. We're going to continue our conversation with folks in the room today, but we have a few poll questions for people to respond to. So if we can pull up our questions for today, and I'll read out the first one. It's very simple, but just in what you've heard today, and if you've read the report, we would love for you to give that perspective as well, but has our summary of the assessment report focused on the appropriate issues for addressing digital equity? So you can respond yes if you feel like it's covered everything that you think is appropriate. But if your answer is no, we also invite you to give some perspective in the chat as to what it's missing or what can be built upon further. All right, I think our responses have slowed down, so we can pause and share results with the group. So it looks like most folks who voted say yes. And for the 5 or 10% of those in the room, please, we invite you to share more in the chat. And what our team is capturing all that information and upgrades there, and there'll be time to build upon those comments. So our next poll question that we have today is, which issue is most relevant to you and your community? Is it connectivity? So talking about access, affordability, infrastructure. Is it equipment and its cost and affordability? Is it digital literacy with training and support services? Or is it something else? And if it's other, please use the chat to describe what that is as well. Awesome. I see some responses coming in the chat. Thank you, folks. All of the above, Tracy. Yes. I know it's hard to pick just one. Okay, I think our responses have slowed down a bit. If we want to close momentarily and share results. All right, so most folks in the room today, about 42%, are saying connectivity, followed by digital literacy as most relevant and important for your community. And then equipment, cost and affordability, and other has also come up as an option. So I encourage folks to read in the chat what folks are responding to in terms of what other issues are most relevant to the communities they live and work in. Awesome, thank you so much. So we're gonna do one more poll in a moment, but we just want to present some context in terms of the Alliance's framework for action. So we know all this, we have all this data now, we have our stories, and there's so much more we can learn, but we know that folks are itching to take steps of action. So we wanted to present just 3 different ways, 3 different strategies that you can prepare to do that. And the first we're calling access. And when we talk about access, we're really talking about online access needs to be available. So thinking about communications and the infrastructure needs to be affordable for everyone, and it needs to be designed for inclusion. Kind of the next framework that you can think of in terms of action is this idea of adoption. And this is really about focusing on the individual experience of a user. So when we look at people, they'll say, I'll use the internet if it matters to me, right? If it's related to a personal goal, maybe it's an educational goal or everything from booking a travel trip, but people will use it if it's important to them, if they know how to use it, and if they feel safe and comfortable using it. So that's kind of another train of thought that we can use when we're thinking about action. And then the last is application. And here we're really focusing on having equitable design of systems. And equitable design centers the needs and concerns of the users and includes everything from thinking about language, thinking about the level of help one might need to use these technologies, security, as we've talked about, and so much more. So we're just briefly highlighting this framework, but again, in our Act Now groups, we're going to be diving into these elements a little bit more, and there's also more that you can read in our Alliance's report. But our next question has to do with this framework, and we really want us to think about what's rising up as priorities for folks in the room. So as the Alliance begins to take action this summer and fall, please tell us your top interests given your understanding of digital equity in the region. We have public policy, digital literacy, regional cooperative clearinghouse, which talks about creating a regional intermediary organization for kind of across the board help. Putting people first kind of action step, which is promoting a person-centered approach to bridging the digital divide. Or if there's another action step that's not represented here that you think might be great to pursue, we invite you to choose other and talk more about that. And I also want to invite Alliance members to keep an eye on the chat in case folks have questions around any of these action options. Wait another few seconds. I see answers coming in still. All right, I think we can close and share our results. So about 39% really looking at public policy, followed by the digital literacy, putting people first approach, and then discussion on the regional cooperative clearinghouse is also of interest to folks. So thank you for sharing your perspective. The Alliance is going to be, in addition to debriefing these poll results, looking at the information that we talk about in our Act Now groups.